This is Dr. Margarethe Hoenig, and in this lecture we will talk about the different insulin preparation types. This slide shows you the multitude of insulin actions. We've talked about this previously. Insulin is the major anabolic hormone, so we see glycogen synthesis, we see protein synthesis, fatty acid synthesis, and we see inhibition of catabolic processes, lipolysis and gluconeogenesis. And of course, in a diabetic, where we have a diabetic is in a catabolic state, we need to stop the catabolism, and with our insulin treatment, bring the animal back into an anabolic state. So the pharmacological treatment options for the diabetic dog and the diabetic cat, even though we said earlier they probably have different types of diabetes, are really similar. For most diabetic cats, we also need insulin because I said earlier that naive diabetic cats, when they are first presented to a veterinarian, usually have low insulin concentrations, unlike the type 2 diabetic person, which usually presents with rather high insulin concentrations. Sometimes in cats we can use oral agents of the drug class sulfonylureas, and here the one drug that is primarily used is glipizide. There are only so many variations in the treatment of an insulin-dependent diabetic dog or cat, and you need to really play with these different variations to try to achieve the best possible control of the diabetic animal. So you can change insulin preparations, you can change the dosage of insulin, time of insulin injection, time of feeding, the type of food or the amount of food to influence blood glucose concentrations. Most of the insulin preparations that we use nowadays are recombinant human insulin preparations or recombinant human insulin analogs. The recombinant human insulin preparations are regular insulin, neutral protamine hagedorn insulin, in short called NPH insulin, and protamine zinc insulin. Also detemir. Recombinant insulin analogs are mutated insulins, for instance glargine. There is only one animal source insulin on the market currently. It's called Vetsulin, and this is a porcine insulin, which is used for treatment of diabetes in dogs and cats. But we also always use other insulin preparations from the human market for the treatment of diabetic animals. So I made a table with the currently available insulin preparations. This is nothing that you will need to remember, but it shows you that there is a fairly large number of preparations on the market. The insulin preparations can be distinguished based on their duration of action. So we have short-acting, intermediate-acting, and long-acting preparations. And except for the short-acting insulin preparations, which can be given intravenously and therefore have a much more predictable action time, the duration of action of the other insulin is variable between animals. So short-acting insulins are regular human recombinant insulin, and then some of the mutated insulin preparations, Lispro, Aspart, they can be given intravenously. So the intravenous injection mode would of course be important if we have an animal where we need to give insulin quickly in order to get a quick action. The other preparations are usually, the intermediate and long-acting preparations are usually given subcutaneously. Of course, the short-acting insulin preparations can also be given subcutaneously or intramuscularly, and it depends on what action time you are interested in. If you give a short-acting insulin preparation subcutaneously, you will prolong the action time of that insulin by several hours. The intermediate or long-acting insulin have a longer action time. Here we can distinguish human recombinant insulins and then mutated human recombinant insulins. I want to mention only one here, and that is glargine, because this is a preparation which is used quite frequently for the treatment of the diabetic cat. So glargine is an insulin that is a clear aqueous solution, and when you inject it, it forms microprecipitates of insulin. It cannot be mixed with other insulins and it cannot be diluted. So most of the recombinant human insulins or Vetsulin, these insulins can be diluted if needed, and they could be mixed with other insulins if needed, but this is not the case with glargine, because this would then disturb or destroy the microprecipitate formation, which is necessary for the normal action of this insulin preparation. So this is a picture showing Vetsulin. As I said, this is a porcine insulin suspension, and it is the only animal source insulin currently on the market. The insulin preparations which are currently approved for dogs and cats are Vetsulin, so Vetsulin for dogs and cats, and for cats only the Porcine. But I want to reiterate here that we frequently use the other insulin preparations that are on the market for the treatment of diabetic dogs and cats. So preparations that come from the human side, we use those for treatment. It's important to remember that every animal reacts differently to a given insulin preparation and that the action time varies between individuals. While we can say that regular insulin given intravenously will act between 1 and 4 hours, the other insulin preparations really can have a wide variety of action times, and it is therefore necessary to find the action time for each individual animal that you start treating for diabetes. This makes it challenging, as you can imagine. So in summary, when we talk about insulin preparation types, we can say that insulin preparations are classified according to insulin source. So we either have recombinant or animal origin insulins. The duration of action, short, intermediate, or long-acting insulins. We said that if you use glargine, and this insulin is used frequently in diabetic cats, you should never dilute it because you will change the pharmacokinetics and pharmacodynamics of it. And except for short-acting insulins that can be given or that are given intravenously, or when given intravenously, the duration of action is variable between animals.